Welcome to Connecticut's Health Report. Episode 1, Good Health Doesn't Just Happen. With Connecticut Department of Public Health Commissioner, Dr. Manisha Jitani. Because being informed is the first step to being protected.
Good health doesn't just happen, it's built. The last time you buckled your seatbelt, did you think about it before you did it? Or turned on the tap and drank the water without a second thought? Or got a vaccine that didn't just protect you, but everyone around you? None of that happened by accident. Someone fought for it, proved it worked, and put data to action. Welcome to Connecticut's Health Report. I'm your host, Brittany Schaefer, and I'm joined by Connecticut's Department of Public Health Commissioner, Dr. Manisha Jitani. And on this podcast, we tell those stories, the people, the science, and the decisions that shape the health of communities across Connecticut. Some of these stories are ones you've never heard. All of them matter. Measles is back, new COVID variants are circulating, federal health agencies are being restructured, and right here in Connecticut, public health professionals are working every day to navigate it all and keep our communities safe. Each episode will bring you the conversations, context, and expertise you need to understand the public health issues that affect your life, your family's life, and your neighbors, because being informed is the first step to being protected. So for those who are unfamiliar with our state's doctor, Commissioner Manisha Jitani, tell us a little bit about your background.
Well, thanks for that opening, Brittany, and it's really exciting to have this conversation. For me, I started my interest in medicine at a young age, and I was a resident in internal medicine, and then I was an assistant chief resident, so one in an educational capacity where I was teaching about medicine to other medical residents. And we had a case of a young college student who went to NYU. This was in New York City, and she came down with Salmonella typhi, or typhoid fever. Mm-hmm. Now, she had not traveled anywhere. She had not gone anywhere that would make you suspicious that she had this bacteria that causes typhoid fever. Usually, we see that in returning travelers. Wow. But the case was reported to the New York City Health Department, and the New York City Health Department then did a case investigation and identified ultimately that there were 6 people in the city of New York who had typhoid fever, and they ended up tracing it back to one fast food restaurant in Queens, where there was a food preparer who was chronically colonized with this bacteria. Unfortunately, was probably not using the best of hand hygiene, had been shedding the bacteria, and ultimately infected a number of different people. Now, I tell this story because it really is part of my origin story in terms of my interest in infectious diseases, my interest in public health, and where those two worlds collided. And from there, that's when I really realized I wanted to become an infectious disease doctor, and I went forward and did that. And I came to Yale as part of my infectious disease fellowship training, had a career there for 20 years when the COVID-19 pandemic hit. And I used that opportunity to really use the knowledge that I had to try to educate people in the public the best that they could be in the context of the pandemic. And in that, I ended up meeting the governor, and several months later got asked to do this job, which is sort of for full circle to the story that I told, because it really brings together my infectious disease background and the various different ways that public health impact our lives and help protect the residents of Connecticut.
It's a very impressive resume and very cool to see you go from just New York and Connecticut for your background so close by and have deep roots here in Connecticut.
Absolutely.
So at the Department of Public Health, a lot of the work is done behind the scenes, and that's how we know it's working. Let's start with the topic everyone thinks about, as you were mentioning, with the COVID-19 pandemic and your specialty, infectious diseases. How does DPH monitor them and work to prevent outbreaks?
So going back to my background a little bit, a lot of what I focused on when I was at Yale and when I was a younger faculty member and assistant professor was diagnosing and preventing infections in nursing home residents. And I went to many nursing homes across the state in the research studies that I did. And that experience was invaluable coming into this job at DPH, because the point in the pandemic when I came into the job, we were still having outbreaks in nursing homes. The impact of the disease was most significant on our oldest and most vulnerable populations. And so that research background I had actually helped inform how we could prevent infections in these congregate living settings like nursing homes. But that just is an example of how our infectious disease partners in Department of Public Health in Connecticut work on many, many diseases. The first is they understand how to surveil for diseases. We do surveillance, we do testing, we do surveillance. And that's the first thing you need to be able to do to really count how many infections do you have. Then we can come up with strategies on how to inform the public about what those risks are. How do they get impacted by the risks that impact them directly in their communities, and what they can do to either prevent or diagnose and treat those infections. So a lot of that goes back to being able to do surveillance for disease, whether it be COVID or whether it be any number of diseases that are reportable to the department. And there are 80 plus diseases like that. So that is a core function that we do as a department.
As for testing, and aside from the main home base here in Hartford, DPH has a big presence in Rocky Hill at the State Public Health Lab. I was lucky enough to get a tour last year, and it is incredible. The amount of testing, the variety that is done there, and just all the equipment, it blew me away.
We really do have a state-of-the-art lab, and we're very fortunate to have that. And I will say the origin story of our lab is also an interesting one, because many labs throughout the country are not as updated as our lab. But our state made an investment in creating a state-of-the-art lab because of the anthrax cases that we had soon after 9/11 in this country. And so we had, at that time, a very old lab that was not the best place to be doing testing for a bioterrorism agent like anthrax. But that really came to light at that time. And that's when legislators made a decision to invest in creating a state-of-the-art lab. And so now we have that. And what that has allowed us to do is do state-of-the-art testing for things like COVID during the pandemic and beyond, where we can do testing to say, if we do have new variants, are we seeing them here in Connecticut? That type of sequencing is really important. The other thing that we do is we may do more deep testing on certain bacteria that can then be tied to other outbreaks around the country. One of the examples I give for that is several years ago, there were eye drops that were infected by a bacteria that was pretty rare. And our state public health lab had done whole genome sequencing. So it gives you the genetic code of that bacteria down to a very detailed level. And because they were able to do that, they found that there was a match with the same exact type of bacteria in other bacteria throughout the country. That formed the basis of an investigation by the CDC that ultimately identified those eye drops as the culprit. You need to be able to have a state-of-the-art lab that can be able to do that kind of testing, to be able to even come up with what the problem was. And so I give our lab a lot of credit because it was in Connecticut that that got started and that we were able to take it from there. But there are a lot of things, like you mentioned, Brittany, that happen in that lab that people would never even know about. We have secret shoppers that go out and buy dairy products and meat products and do testing to determine if what you buy off the shelf is in fact safe to eat. And that's the type of thing that, as a consumer going into a grocery store, you would never even think about. But it's that type of work that's happening behind the scenes that's really critically important.
That is so impressive. I had no idea.
And, you know, the list really goes on and on. If you think about it, when you have, let's say, an animal that might have come in contact with somebody, and you're worried about, are they rabid? Does that animal have rabies? Our lab does testing for each of those animals that gets sent to them. Our lab can do testing for even environmental contaminants. So when we think about lead poisoning, we have our local health departments. If you have a child who, let's say, has a high lead level, they'll go out and do wipes of windowsills and other samples, and our lab can do that testing to determine, was there lead in that environment? We've heard about PFAS before, something that can contaminate our water supply. that type of testing happens at our lab. So there are so many forms of testing that happen. If you have a new baby who's born in your life, and when they are born, there's newborn screening testing that is done. That is to identify genetic diseases that, if found early, can be treated quickly so that a child is not identified much later in life or potentially even die before they knew they had the condition. So the kind of work that's happening at the State Public Health Lab is very basic to all of our existence. We just don't even know it's going on.
Seriously, I mean, the food investigations, rabies, anthrax, of course, all of this are really like life or death situations. So DPH also licenses and regulates hospitals, nursing homes, other healthcare facilities. What is DPH's role there?
We are the state agency that is entrusted with ensuring that healthcare delivery is safe and of high quality. And when the public goes into a facility, they want to assume that that's the case. Now, there are two ways that we do that. We have regulatory authority from CMS, which is the Centers for Medicare and Medicaid Services, the federal agency. And we as DPH are the survey agency. We are the agents of the federal government to go around to our nursing homes and hospitals and other healthcare facilities to ensure that federal standards are being met. That in fact, what has been laid out as what is quality care is in fact happening. So we have a very large team of surveyors that go out and do that on a regular basis. In addition, we have a portal where if somebody is experiencing something that they don't think is right in a healthcare facility, they can submit a complaint. And when they submit that complaint, we have professionals who triage them and identify which are the most significant and need to be investigated as quickly as possible. And after they make that determination, again, we have surveyors that may go out and do complaint investigations. So we have usual recertification investigations that happen every 12 to 15 months in nursing homes, for example. And then we have those that happen on a more ongoing basis when we hear of complaints. And it is the best way that we can ensure quality care in nursing homes. We then partner with sister agencies to ensure that all of us are working together to ensure the highest quality standards that we can.
That's just a wide variety of even just regulatory oversight in some of these facilities that is so important. Now, switching gears, environmental health also has a big impact on public health and covers a lot of ground at DPH, from drinking water, lead control, as you briefly mentioned. What do you think impacts residents most here, but they necessarily don't see the work being done?
The most important one is the one that you mentioned, which is drinking water. So 2/3 of our state turns on the tap every day and is getting water from a municipal water source. And just like we have regulatory authority on healthcare institutions, we have that same entrusted authority over drinking water. And for people to have that faith that the water is toxin-free, bacteria-free, there are lots of standards that are in place to ensure that drinking water is safe. And that is a very core function to what we do as part of DPH. But as you mentioned, there are a lot of other environmental toxins, whether it be asbestos or lead or PFAS, and the list sort of goes on and on. And we have different capacity in terms of our regulatory oversight of those other contaminants, but that type of environmental health protection is equally important as healthcare quality and safety. And so these two regulatory functions are really critical to our functioning and to the way that a society can function to ensure that many of the things that are now foundational and assumed in terms of basic protections in a society, like drinking water, do not exist everywhere in the world. There are many parts of the world where safe drinking water is not something people can take for granted. But because our public health infrastructure in this country, and particularly in the state of Connecticut, have been advanced enough where we can count on that, that is something that we are entrusted with and work very hard to continue to ensure hold up every day.
We went over so many things that the Department of Public Health does here in Connecticut, and I feel like we just skimmed the surface. So there is a lot to talk about here. I think we could talk for hours about what is done behind the scenes, but I hope this gives our audience here just a better understanding of a little bit of the work that is done here at the Department of Public Health. We didn't even touch upon chronic disease, gun violence, injury prevention, maternal child health, vital records. There's a lot to cover. So stay tuned for our next episode where we will be chatting about everything you need to know about ticks and mosquitoes as the weather warms up. Until next time, this is Connecticut's Health Report.
Thanks for joining us. Catch the full video on YouTube and stay connected with us on social media for the latest on health in CT. See you next episode.